Hi, I'm Dr. Dustin Dippin. I'm a psychiatrist, and this is meant to be kind of an informal video about borderline personality disorder. Something that we see a lot on inpatient units, but it's also just really prevalent in the general community. And so I was thinking just a little bit of a chat here for 5 minutes or less, hopefully, would be helpful to support any understanding that we have on how to support these people and how to identify and maybe understand a little bit better about what's going on with them. So the statistic I was quoted some time ago was 1 in 30 women and 1 in 50 men meet criteria for the disorder. So you could say about 2% of men or 3% of women may meet criteria for borderline personality disorder at some point in their lives. I've also heard that it's a lot more prevalent on inpatient units, of course. These are people that often draw the attention of healthcare providers and emergency departments or get admitted to inpatient units, usually because of thoughts of self-harm, overwhelming depression. And there can be a pattern of sort of broken relationships or really tumultuous relationships leading to fears of abandonment, and then people's attempts to maintain the relationship or destroy relationships before they feel overwhelmed by the potential that they could fail. And so this is often the time that we see these people in crisis, is when there's some rupture in a close relationship with like a significant other, a friend, a family member. And it's usually in the context of a self-harm gesture where they've sort of done something to harm themselves and let someone else know what was going on, or sometimes a very severe suicide attempt. One of the hard things about borderline personality disorder is that because there is often thoughts of self-harm and even self-harm behaviors, even though many people do not intend to frankly end their lives during these behaviors, it is more likely, as people have the behaviors, that one of them may be accidentally or intentionally successful. And so for this reason, people with this disorder are at a much higher risk of passing away. They can be very impulsive and reactive to stressors, especially interpersonal stressors, difficult conversations, emotional tensions. Part of the treatment is helping people understand what makes them upset and identifying triggers and being able to track when they're getting upset, and then also find alternative ways of coping when they are feeling overwhelmed. And so this is kind of the basis of what we do, is to try to help people understand what's going on with them and to be able to have self-awareness, mindfulness about their emotional state, and then also to choose, ideally, to do something different besides self-harming or destroying a relationship or some other behavior that won't really allow them to get their needs met. At the end of the day, a personality disorder, is that the personality that we all have, that we use to get our needs met in the world socially and economically and for our basic needs, that doesn't work for the person. So if you have a disorder, your personality on some level is not functioning. And for someone with borderline personality disorder, that's often on an interpersonal level, that people who are really afflicted with borderline personality disorder frequently have burned bridges with family members, friends. Sometimes they only have professional supports remaining, a case manager, a therapist, a psychiatrist. They can have a really hard time in group settings or individual settings. They can feel either lonely and estranged, or they can feel a lot of tension trying to remain in relationship to people. There's kind of a famous book called I Hate You, Don't Leave Me that speaks to this idea that, although I may sort of act out and we have a lot of tension between us, I really don't want you to leave me. In fact, I might be feeling this tension because I'm afraid you're going to leave me. And so I think that's something to bear in mind when we're working with people with this disorder, is that at the end of the day, they are looking for connection, even though it may seem that there's a lot of vehement hate and anger coming off. Just remembering that ultimately this person is trying to get their needs met and they're probably looking to connect. Another book that I really enjoy that I think would be useful if you're looking for books to read is called The Buddha and the Borderline. The reason I like it is because it's told from the first person perspective of someone who really struggles with borderline personality disorder and has a realistic narrative. And at the end, the person's not all better. They say, I still struggle with these things, but I am aware of them and I try to do these things. It also goes through and talks about all the different types of treatment, and it presents them in a way that patients can understand, your everyday person, but also in sort of an academic way. So you understand, like, this is acceptance and commitment therapy, this is DBT, this is what these medications do. And so I think that's a useful read for anyone that is interested in the topic or wants to work with these people a little bit more in depth. There's Demystifying Borderline Personality Disorder. That's a great read for families. There's lots that could be said about people with borderline personality disorder. I'm over my 5 minutes. But I will say, remembering that at the end of the day, even though these folks may come in hopeless, very angry at staff and other people, splitting between staff, you're all good, you're all bad, idealizing one and then devaluing another. There's often staff members that are on either side of that split. Some are all bad, some are all good. This can be very challenging to kind of work with some of these dynamics. You can feel personally hurt by the way they act towards us. I think trying to maintain compassion and realizing that even an angry outburst with a lot of projection of hate and blame is really their attempt to self-regulate, to feel better. And unfortunately, it's on us to regulate ourselves and to demonstrate that way of regulating our emotions, even in the face of a lot of emotional tension with these folks. That's probably the number one thing we can do, is just to kind of be receptive, compassionate, not overreact, and kind of normalize their behavior and feedback to them whenever possible that the real issue is, not that so-and-so stole the last oatmeal or so-and-so looked at them wrong, but it's the way that we all cope with our emotional state inside. So I hope that's helpful. I'm happy to put out more videos on this topic or other topics. This is just kind of the first one I made to try to speak a little bit to this really common thing that can be really upsetting to a lot of people if you don't understand what's going on. Okay, thank you. Bye.